Hello. I've put together this short video to hopefully explain the next steps to you once you've decided to go ahead with your knee replacement surgery. Now, the first step is making sure that you've had all the information that you require to make sure you've had the time and the space to make that decision. I often encourage my patients to ask questions, ask about the benefits, ask about the risks of surgery, ask about the alternatives to surgery, and often patients will ask, well, what if I do nothing? So hopefully we'll have gone through those with you, and that will have helped you make your decision. I understand that for a lot of my patients this is a big decision, so I offer everyone a cooling off period, and this is a time for them to reflect, maybe speak to their relatives, loved ones, family, friends, and just give them time and space to make sure that they've made the right decision. I'll pencil in a follow-up appointment, which is free of charge, a couple of weeks after you've made that decision, when you're already on the waiting list, where we can complete the first part of the consent form, which will confirm that you're happy to proceed, that you understand the risks, and that I'm happy that you understand the risks, the benefits, the alternatives. We complete the paper consent form, which then goes in your health record. Following this, you'll be invited to come to the pre-op assessment clinic. Now, this is run at the hospital, and usually members of the preoperative team will ask you some questions about your general health, check which medications you're on, if any, and give you advice about medications, which ones you have to stop, perhaps prior to surgery, and all the specific advice around making yourself as fit and as healthy as possible before your surgery. Any further tests such as blood pressure, heart racing, things like this can be organised at this stage. The next time we see you will be when you come in for your surgery, and on the day of surgery you'll be welcomed onto the ward. You can bring a friend, family member with you, and they will usually show you into your room and help you get settled in. They'll do some basic checks of your blood pressure, temperature, and then you'll be seen by myself and the consultant anaesthetist, who will be performing the anaesthetic to help us do the surgery and help with your post-operative pain relief. They'll go through the risks and benefits of the different anaesthetic choices with you, and also talk about the pain relief that you'll have after the surgery. Once all this is done, the next time I see you will be in the anaesthetic room, where we do some final checks and get you ready for your operation. This is usually the easy bit, I say to my patients, where you'll have a nice lie down for an hour or so while I do the hard work, but the caveat being that your hard work will start after the surgery, once you're back on the ward, and once you're starting with your physiotherapy and exercise program to rehabilitate you, get you back on your feet. After the operation is finished, after about an hour or so, you go to the post-operative recovery area in theatre, where your blood pressure is monitored, you make sure that your pain relief is adequate. Once everyone is happy, usually after about 15-20 minutes or so, you go back to your room on the ward, where the nursing staff will make sure you're comfortable, safe, give you something to eat and drink, and once you're comfortable later in the afternoon, your physiotherapist will come and show you some exercises and try and get you out of bed. We like to get our patients walking, standing on the day of surgery, and depending how comfortable and confident they are, that can just mean a few steps to the end of the bed, or it can be a bit further. We'll keep pushing you every day to do a bit more, and once we're happy, and once you're happy that you're comfortable and confident, then we can make plans to let you go home. The next time we'll see you would be then when you come in to have your wound checked and the stitches removed, usually about 2 weeks following the surgery. and following that we'll have a checkup at about 4 to 6 weeks to make sure you're heading in the right direction, see if there's anything else that you need, answer any questions, and often give reassurance that you're doing okay. The recovery period is hard work for lots of people, and often a bit of reassurance and encouragement is all that's required at this stage to give people the confidence to keep up with the exercises and keep pushing themselves forward. So hopefully that's explained a little bit about what's going to happen next. Obviously, any questions, any information you need, please do get in touch, and we'll be more than happy to answer your questions. If there's any more information you need, any more literature you need, we'll be able to provide this. So hopefully we'll see you soon, and I look forward to helping you get rid of your knee pain and helping you get back doing the things that you enjoy.